Good afternoon, ladies and gentlemen. Welcome to Political Fight Club. I'm your host, Robert Durden. Today I'm going to be talking about Medicare for All again. Now, the conversation hasn't really reignited the way that it was during the first Medicare for All forced the vote fervor, but I'm glad that it's back in the news. It's kind of hard to find, honestly. Like, not a lot of people are actually talking about Pramila Jayapal bringing the bill that she wrote, that's a 2-year rollout Medicare for All bill, to the House floor. Now, it's going to sit in committee for fucking forever. Maybe literally. And that's what I'm talking about. But there is some conversation being started, and that's good. So I'm rolling with it, even though I think it's probably a lost cause. And if we can just somehow force the vote, not get Medicare for All, but just get people on the record, that would be fantastic. So I want to thank Mike Figueiredo for bringing my attention to this article that just came out. I think it's from Public Citizen, and it basically is an awesome article with all these studies about how COVID has exposed the U.S.'s privately run healthcare system as being absolutely inept, especially when dealing with something like a pandemic. This is a stressor on an inherently unstable system. Most people would argue that's the worst part about capitalism, is that it can run okay for a little bit, but it's an inherently insecure system that has a lot of people falling through the cracks, and it doesn't do well in times of stress. So when you privately run a healthcare system, it gets destroyed when a virus like this comes along and it gets exposed for what it is, the same as when Texas had that blizzard come through, it exposed why privatizing an electrical grid is a bad thing. Under stress, capitalism does not do well. So this article is wonderful, and I'm going to post a link below, and I'm just going to read to you just 2 excerpts, and there were tons of references in here too. I read one of them, and I'm going to continue to read more, and I'm going to highlight right at the end of this the most insane stat that they found that I think makes the argument for we need Medicare for All right now. Basically, this report explores the system's focus on generating profit and revenue for wealthy corporations instead of health and well-being for the American people in a number of ways, and there's 6 ways. Number 1, private insurers profiting by limiting access to care. 2, millions losing their insurance when they lost their jobs due to the pandemic. 3, hospitals focusing on profit and revenue over patient well-being. 4, many nursing homes failing to meet patients' needs, and that's of course because they're not profitable. Nursing homes, it doesn't pay to just invest in nursing homes and protect people. Ask Andrew Cuomo. 5, our public health preparedness system lacking adequate funding. And 6, the massive health disparities experienced across the U.S., including the particularly devastating effects on communities of color. End quote. So that 6th one also is something we need to push hard, because Medicare for All is a racial issue if you consider that the pandemic hit, African Americans, Native American tribes got hit super hard because they don't have, good access to health care where they live. Obviously Hispanics, a lot of them don't get access to health care or are undocumented or are afraid to go to the doctor because they're afraid they're going to get deported. And just poor people in general are afraid to go to the doctor because of copays that they know they can't pay, even for things like checkups. And this goes over that over that exact point in this article, where they're talking about how a significant portion of Americans, and it was a lot, I forget exactly how much it was, I think it was like 1 in 3, that had symptoms of COVID just didn't go to the doctor because they're simply too afraid that they won't be able to pay their deductible or copay or getting slapped with a bill. And then the last thing I'd like to quote for you in here was the thing I was talking about is the most bananas stat in here. A recent study found that 1/3 of COVID-19 deaths and around 40% of infections were linked to lack of health insurance. For every 10% increase in a county's uninsured rate, the researchers found a 70% increase in COVID-19 infections and nearly a 50% increase in deaths from COVID-19. So they correlated that there were a significant amount of extra deaths due to COVID due to underinsurance or uninsurance, which we already knew that. But now they've quantified it, and they say that around 33% of COVID deaths and 40% of infections could have been otherwise avoided if we just had some sort of universal healthcare system. So it's a great article. There's a lot more stuff in here, and I wish I could go over it all with you, but I don't want the video to be too long. Just read the article. But what we need to do is run with this. This just came out. Let's plaster it everywhere while Medicare for All is back in the news, kind of, I guess, with a squad doing what they're doing right now. Let's push it. Maybe we'll get the vote. Because this frames it in a way that is like, well, COVID's not over, the vaccines are on their way out, and that may or may not help, but I think we're still years before COVID is either under control or endemic. So this is a valid argument still for at least a couple more years, because we're still going to be battling it, going into 2022 and 2024. Why not fight for Medicare for COVID? This bolsters that argument. So, and there's going to be another pandemic that comes along about every 100 years, and who's to say there's not going to be more coming along? Climate change usually leads to a lot more new bacteria being released into the air due to permafrost melting, but I don't want to go too much down that rabbit hole. The point is that this is a valid argument now, and is going to continue to be as long as the pandemic is in people's minds. So let's fight for Medicare for All. Thank you to the Humanist Report for bringing this article to my attention. It's awesome. And keep fighting the good fight out there, guys. I'll see ya.